Welcome to AHRA's Medical Imaging Matters podcast series, where we explore the people, perspectives, and practices shaping medical imaging today. I'm your host, Jason Newmark, the Executive Director of AHRA. So in this episode, we are going to shine a light on a vital and yet sometimes under-recognized, some might even say still evolving part of medical imaging teams, the role of nurses. Specifically, we explore how imaging nurses enhance patient care and their experiences, how they collaborate with technologists, radiologists, and our other team members, how they navigate various reporting structures, and overall how they truly help support optimal operational workflows and cultures of full team engagement. Our guests will also share real-world examples and their perspectives on how to make the case to have dedicated and consistent nursing support in imaging services. So I'm joined by two great friends and fantastic leaders in this field. We have Whitney Utt, the newly elected president of ARIN, the Association for Radiologic and Imaging Nursing, and the current Imaging Services Nurse Manager at UC San Diego, and Wendy Renneke, a current member of the AHRA Board of Directors, recently elected for a second term, and the Diagnostic Imaging Manager at Seattle Children's. So during our talk, we will also discuss the growing partnership between AHRA and ARIN, and what this means for our members, the broader medical imaging community, and with regards to new offerings for professional development, the sharing of best practices, and, of course, enhanced networking opportunities. Most notably, this will all happen at our upcoming joint annual meeting this July in Orlando, Florida. This is an engaging and a timely discussion, and we are so excited to share it with you. On to the show. All right, well, good morning, Wendy. Good morning, Whitney. I could not be more excited to start my Friday and head into the weekend by chatting with the two of you, and I appreciate you getting up bright and early. So for me, East Coast time, I think it's around 10. For you, bright and early, a couple hours earlier. Anyway, like I said, I'm so excited to chat with the two of you. Today's topic is all about medical imaging leadership, but also the importance that nurses play in that role and how they interplay with our administrators, how they take care of our patients, and all the things we can do collaboratively to enhance the care that we provide to the patients and those kind of things. And I'm also excited to really talk about the new relationship we have between AHRA and ARIN. So a lot to go over. You guys are the experts. I'm just going to sort of get us started here. But how about we start with this? Why don't we do some introductions? Why don't we start with Whitney, and you can just give a little background and we'll let folks know who you are.
Hi, I'm Whitney Utt, current president for ARIN. I'm in San Diego, California, and I'm a morning person, so this works out perfectly for me.
That's great. And congratulations, because the presidential step to that role is very recent, right? Just over the last few weeks.
Yep, in April.
All right, we're very excited. All right, and Wendy, who I've known for a very long time.
Hi, I'm Wendy Renneke, and I am a very proud AHRA member, and been in medical imaging for just over 34 years. And I work at Seattle Children's Hospital as a diagnostic imaging manager and current board member of the AHRA.
That's right. Current, I can't even say re-elected board member, right? Another term.
Second term loading.
I love that. And you and I have a lot of history, Wendy, so we got to decide what stories we're sharing and not sharing while we're chatting this morning.
Right. We'll keep things safe.
That's right. Well, how about we just dive right into it, right? So I think, in our prep calls and just over the last several months, we talked a lot about the importance of what we do to support medical imaging leaders. But I think the idea of the nursing side came up as an opportunity for us to do something a little bit different. I think ARIN has been out there for a long time, and AHRA has obviously been out there for a long time. But the idea that we're going to collaborate together is something new. And actually, Whitney, you know what? Maybe I'll pause. Do you want to give a little overview of ARIN? So maybe some of the listeners don't know as much about that. Maybe I'll give you a chance to do that.
Yeah, sure. So ARIN stands for Association for Radiology and Imaging Nurses. Sometimes people call it ARIN, our friend ARIN, but ARIN has been around since the 1980s. We have about 1,000 members, and we are the one-stop shop for radiology nursing education. And so we have a new core curriculum coming out soon. We've done a bunch of updating and stabilizing post-COVID, and we're super excited to have conference coming back this year.
I love it. Yeah, me too. I'm so excited. So this is interesting. So I know, a lot of times when I was just talking to my daughter this morning and I mentioned what we were going to talk about, she's 14, right? And it's a perfect example of what some folks that don't understand all the opportunities are in healthcare, they don't realize. So I mentioned nurses, and she's like, well, why nursing? Well, what does nursing have to do with what you do every day in radiology or in medical imaging? It just made me laugh. I was like, Reese, I should have had you sitting here with us and have the conversation, right? I think often, people think of, I'm going to go into healthcare, I'm going to be a doctor, I'm going to be a nurse, right? And then, now mind you, that just missed my whole entire world and Wendy's world about medical imaging. But there's so many different tracks in where you can get involved with the healthcare, delivery of healthcare. But also in the nursing side, there's multiple specialties and multiple areas they can focus on. So maybe between the two of you, let's talk about that unique area where nurses fall into the medical imaging space, right? And either one of you can dive in here, but I'm curious your thoughts. Maybe you can just give an overview of where you see the nurses and the kind of roles they play and sort of how that came about, where they actually became dedicated nurses in the medical imaging spaces.
Honestly, I mean, I can start off. The nurses in our medical imaging spaces in radiology are critical to our, the patient care and the continuum of care beyond our radiology departments as well. But within our departments, that relationship clearly inside of the IR suite with like our IR nurses, our interventional radiology nurses, and then they feather out into like our recovery spaces in radiology. Here at Seattle Children's, we do a lot of anesthetized procedures. And so the relationships that our technologists have with the recovery room nurses and the nurses in my former role at UW Medicine, the nurses throughout the department engaging with our radiologists and our technologists, everything from difficult IV starts to port access to things like that. And so the radiology nurses are on a day-to-day basis critical to the operations of our department, and the relationships that we build with them as technologists and administrators is incredibly critical to the successful outcome of our patient care, and the relationships that we build to support each other and manage each other's roles up, create understanding for the importance of each other's role and the respectful relationship of each role, also imperative to how we function every day. I have a huge heart for our nurses, and my sister is one, so maybe it's a little familial as well. But that relationship for my entire career has been something that I have been very proud to be part of and couldn't be more grateful for.
Yeah, I echo that completely, Wendy. Thank you so much. It's funny that you mentioned the familial tie because my dad was a nuke med tech, and I tell that story all the time because I didn't know that I was going to end up in radiology, but here I am and I love it. And I love that there's a place for me, even though I became a nurse within radiology. I think the list is shorter for the things that nurses don't add value to in radiology. Like, it's just, we are the connection with the world outside of radiology, with the rest of the hospital. It helps us break down silos. We provide a highly reliable dedication to process. We're thinking about the patient. We're thinking about safety. And as technology has become more advanced, there's more exams and more procedures that require medication monitoring and that thoughtful collaboration and communication between the multidisciplinary team.
Yeah.
If I could, Whitney, if I could take that relationship that our nurses have with our technologists in radiology and the mutual respect for our roles and the importance that each of our teams play in patient care, and feather that out beyond radiology to have that same respect throughout our hospitals and care centers. Like, there's some magic. There's a secret sauce that happens in radiology because radiology is this huge family. And the collaboration and the respect for each other's roles within our bubble of radiology is such a wonderful thing. And when it's working well, like, there's a lot of love there. And I agree with you that the importance of radiology nurses reaching into the rest of our, organizations and spreading the love of what that relationship looks like and that respect factor that lives in radiology is huge.
Yeah.
Yeah.
So it's interesting to me. Like, I found that this came from just my own career as well as when I was doing some consulting and traveling around. Some places didn't have the nurses, right? So do you realize that some of the smaller organizations, maybe they can't afford it, or maybe it's not a role they have, or maybe the nurse rotates through to help out, but they're still sort of in nursing and separate. Some of the places I was able to work at later in my career, larger academic or larger community hospitals where I think we had different resources. It was interesting to see then the nurses were actually dedicated in the departments. Do you guys see that too? And Whitney, maybe you're out in a pretty large place, right? You're in San Diego, right?
Yeah, UC San Diego. So It also brings up a good point as you pull different groups together, you might also be pulling different groups apart. And there's cultural considerations when you're doing that. And so when I arrived here in San Diego, we had more dedicated nurses to CT, nuke med, MRI, and over time we were able to bring that group together where they have a nursing community with each other and they're cross-trained to go to all of the different modalities. That makes sense education-wise, it makes sense staffing-wise, it makes sense so people can have time off, vacation, have sick days without having to affect patient care.
Yeah. Well, let me ask you this. I said, we'll get into the nitty gritty on this one. So I'm curious, like point and counterpoint, but where you guys see it. So like, I'll go Whitney first. So for you, what do you think the biggest value is by having a nurse in some of the areas you mentioned? Like, what does that bring to an area where, we're taking images and obviously we're taking care of those patients, but well, like you think of 2 or 3 things that you bring. And then Wendy, I'm curious where you see the nurses bring from 2 or 3 things.
Yeah, I mean, I think that patients are getting ever more complex as we have the medical field advancing. And so more of our patients than ever have difficult IV sticks. They have ports that need access. That's part of the nursing scope more than it is the technologist scope. So you're really able to take care of more complex patients with nurses around. More of our patients have pacemakers and need monitoring and need programming, or examples like that, where you just have a lot of advanced technologies where as you put those things together, maybe the patient has a port and a pacemaker and all these other things going on. You need a nurse around to help you with that.
Yeah.
I think that those roles are evolving a bit. I think the biggest thing is for our technologists and our nurses to recognize each other's scope, and that a rad tech has all of the knowledge about applying dose and what does proper imaging look like and what do we do to get those images, what position do we need, things like that. We've got the radiology and radiation background, the nursing scope, techs rely on them for the pharmaceutical background. In particular, when we need some chemical restraints, when they are monitoring our patients during anesthesia cases, even like some conscious sedation cases, things like that, there are definite respect for scope that has to be part of our day-to-day within our departments and how we interact. I think that some of those things that Whitney mentioned, like ports in the organizations that I've been at, techs are starting to be able to access ports. There's specific training we have to go through, but not everybody's comfortable with that. And so we still rely on those nurses to train us and go through specific training and lean into their knowledge base so that we learn to do things correctly, because that hasn't always been part of a tech scope. And difficult IV sticks, like, we trust each other for what is what. And I know that in my career, I'd come up on an IV that I couldn't get, and then I'd rely on the nurses. The nurses came up on IVs that they couldn't get, and they'd say, "Hey, Wendy, can you come over?" So it's that mutual respect thing of being able to lean into each other when we come up against an obstacle or just something that's not part of our scope. Realizing our scope and realizing where we step off and they step in from both sides of that is super, super important.
I agree completely. And there's also overlap in our scope that sometimes requires additional communication collaboration, because today I might be pulled in this direction. And even though I can do this for you, I might not be able to because there's this other thing going on. And we're constantly working on that communication piece.
Yes, communication, the C word. It's amazing. And when you have a team that's willing to communicate well, and again, building on the respect and the collaboration and the trust that we build with each other creates that line of communication where we're like, when you have to say, I did this the other day, but today's not the day. And how do we figure this out differently? I'm going to shoot your team member. I'm going to do something like that. That is, again, like that magic in a department that's built on trust.
Yeah.
Yep, and mutual respect.
Well, I love where you guys are going, because I think about this a lot. Even, like I was lucky enough to have those nurses in place in the organization I was at, and they made the same impacts you guys are talking about. I mean, to me, if I take it another level up, it enhanced the quality of the services we provided. Because I think we had, like you said, expertise from both sides, and it enhanced the patient experience. So they knew they were getting a little more hand holding, that somebody could spend a little more time with them. And I mean that both ways. I don't mean it all falls on the nurse or all falls on the technologist, but without the two, someone has to do all of the work, right? So to have someone else there that can help out, that could be another sound, someone who's holding a hand, whatever that calls it, right? I also felt it was really good for team engagement. So team could focus on where they wanted to focus their skill sets to be really good at it. And they could also realize that, hey, we are a team. I can rely on each other. I see someone coming in to help me out and all of that. I mean, obviously, we'll talk about some of the challenges that come up at times. And there's some things that are a little bit interesting between the relationships at times. But the high level, if you can afford it and you can make it happen, I just recommend people have that conversation, look for ways to bring these positions together and support each other. I just think it just enhances the overall providing the service you're providing across the board. So digging in a little bit deeper, so some of the folks may not appreciate this as well. Do you guys want to talk a little bit about the specific areas that you'll probably see a nurse, right? Or where we may start to see nurses in play in the imaging space? I mean, I know for me, I have a couple ideas where I had them, but I'm curious. And Wendy, I guess you're gonna have to wear two hats, right? But from the children's hospital side, and then when you were at a broader center, and then Whitney, kind of from your experience. But if we just listed them out, are there a couple of modalities, a couple areas that you sort of see folks in the role that the nurses play?
I think that there's radiology is everywhere and everywhere is radiology, right? So we aren't just ambulatory and we aren't just inpatient. We have ER patients, we have ICU patients, we have outpatients. We're pre-op, we're PACU, we're intra-op. I mean, there's really no limits. And so that's why it's so important for ARIN to have kind of a one-stop shop, because otherwise you would have to go to all of these different places to get that education and get plugged into those things. So if you ask me, radiology is literally everything, and we have to be able to meet that need and have resources available to be able to call the people we need to for those different circumstances.
I love that. I was waiting for someone to go general and big, like, hey, I'm like, I totally agree. Oh, Wendy, what you thought? Yeah.
I think that, I mean, I have long said that radiology is, pardon the expression, but the gateway drug to every network and service line within a healthcare organization. It is the gateway to a diagnosis that needs a treatment, that needs a therapy, that needs follow-up, that needs all of the things that come after that. Whether it's services in the OR or physical therapy or infusion or all of these things. And nurses and technologists have to link arms in the beginning so that they can access that care moving into their treatment plans after imaging. And just as Whitney said, the nurses are everywhere. So are the technologists. They are on the floor doing morning portable runs. They are in the OR. They are, they're in our imaging suites side by side in cases that are with anesthesia, working with the anesthesia nurses and the anesthesiologists. So that breadth and that scope and realizing just how we literally are everywhere, whether you are a nurse or a technologist, and the knowledge that we carry with us in the different environments within a singular organization is really important to recognize just and respect that what everybody carries with them. And the difference between like children's and my role at UW, we have a different nursing structure here a little bit. Like we have our own nurse recovery area for children's and things like that, because so many of our cases are sedated. At UW Medicine, we had our IR nurses, we had radiology nurses that were assigned to float through like biopsy procedures in CT and MR. And we didn't have a breast imaging center, but in other areas like our Northwest Hospital with UW Medicine has a breast imaging center where they're doing their stereotactic biopsies and things like that. And nurses may come into play in that area. So I think that nurses are very, as you mentioned earlier, organizationally specific in their role and where we see them. But I think you turn around at any time in your day and you're going to see a nurse, at some point in the hospital, and the same with techs.
Yeah, I love that. You guys said that it's a broad application where they can be in the different areas you might need them. And I love your whole point about imaging being the front door. I used to say I oversaw imaging in lab for many years, and without imaging in lab, everything comes to a halt, right? That's how you're diagnosing things and you're moving forward.
I just had a conversation with one of our surgeons the other day in the hallway, and I was talking about, and this could apply to nurses as well, in that OR environment where it can be very, very tense and frustrating. And the whole team feels frustration, right? When things are going well, they're going well. And then when things are like, especially with imaging or whatever is going on, and everybody senses that, frustration and people become tense. And I was advocating for my technologist who was in a specific case. And I said, what I need from you, and I think this applies to our nurses and our techs everywhere as well, is that everybody feels like they are part of a team. We are collectively involved in a successful outcome for a case for a patient. And when everybody feels like they are acknowledged, recognized, and welcomed into that team as part of a practice of people that are working for the best outcome for a patient, then we're going to do great. And I looked at him, I said, because I'll guarantee you that in that moment, you really need that image to complete what you're doing. Because I said, otherwise, you've got a whole lot of guessing to do without that image, and you're not going to get very far.
That's right. Well, it's funny when you guys were talking about just I'm picking up on things. I'm looking back. One of the nurses that I probably came across was first in my years of overseeing imaging. We were an outpatient center at a breast center, and we had a nurse navigator. Her name is Michelle Spear. If she's listening, she was outstanding. It was one of these people who just lit up a room and was the person you wanted when anyone was getting unfortunate news or was nervous or had questions, and just handheld her, right? And she was the one that they would go to talk about, okay, we have a finding and now here's what's going to happen. And they'd educate that. And I'm going to help coordinate your biopsy. I'm going to coordinate your visit with the surgeon. I'm going to be there when you meet the oncologist. It was just an amazing setup. And then they, as the program grew, they added some more resources to go with this particular person. It's funny. I haven't thought about Michelle in a while until you guys were talking and giving her a shameless plug. She also was she was my office mate next to me. But I love that. And that was a place where I really saw the value of having someone that could do that. And then to your point, there are some hard sticks, or we had some recovery areas where the technologists were like, listen, if I'm sitting with a patient, I can't be running machines. And then we're like, that's not efficient. And plus, some of them were like, well, what do we do in this situation? And where I was going here is we had a joint commission inspector. I'll never forget this one. And they're coming through and they said, okay, if somebody has a allergic reaction to the contrast, it was MRI we were, or this, that, or the other. And they asked the radiologist this, okay? The radiologist was there. Said, what do you do? And the radiologist obviously is the person that's supposed to be in charge. And the radiologist like, well, I call the nurse. It was amazing. And we were all laughing. Even the joint commission person started laughing. And I think he actually said, I haven't intubated anything since a cat in medical school. I always call the nurse. That was his phrase. And we couldn't believe it came out. And secondarily, we laughed. But we all joked afterwards that, hey, to the nurses, we're like, you indirectly got the most amazing praise there was, that, the radiologist who's ultimately responsible for what goes on the site just said, you're the one in charge if there's a situation.
I actually love that you brought up contrast reactions, because I think that's a point where the relationship between nurses and techs really shines because of exactly what you said, especially in our off-campus locations. So like ambulatory imaging, for instance, where we may not always have a radiologist on site and we lean into other providers to cover contrast reactions. I can recount several times as a leader in radiology where a provider covering contrast was like, they're fine. And the nurse and I looked at each other, we're like, no, come back, and because contrast reactions can crump so quickly, or they look great for a minute and it's a little delayed and then they're not okay. And when the nurse and the techs give each other that look, we're like, elbow them back. And so that's when like the expertise of both, because of historic knowledge, and nothing replaces historic knowledge. When you know what you've seen before and you reflect on what you're seeing now, and you just that gut feeling. And no matter how educated we are, there are just times as nurses and techs when your gut feeling tells you something else has to happen. And that relationship starts to work seamlessly in those moments. And there have been a lot of patients' outcomes that were much better because of it.
Yeah. Well, all right. Well, let me ask this. So let me ask you this question. So this was always a little interesting sticking point for my department, and it was about reporting structures, right? So I remember there were some criteria I thought back in the day where a nurse had to report to a nurse, and it gets a little confusing if they report to a radiology administrator who may not have an RN background and all of those things. And like, can you speak to like what you see, or maybe what your members at ARN are seeing in terms of what's the most common model, where the difference models, or how that plays out? So I know this is always something that comes up.
Yeah, I think that there still are nurses in radiology reporting up to radiology administrators. And I think more and more we see institutions adopting nurses reporting to nurses. I think what's important and underlying that concept is that you have to plug your nurses into their broader nursing community because of the way that we're taught to think, because of our scope of practice. And so as long as you have that plug in, maybe you have a matrix reporting structure, you're still able to provide that resource and phone a friend for how should I be doing this? What is the best practice? Providing a space where we can have that conversation is really what that's about.
Yeah, because you think some nurses are nervous about going into imaging if they're not tied into nursing as heavily as they would be if they were in a true nursing unit, nursing floor, because sometimes you could be an island of one, right? If you go to a radiology department, right? Or maybe a smaller one or two of you versus you're part of the whole spectrum.
Yeah, and I think there is a need to provide a safe space for, you have to have a certain amount of experience. And so do you have a new grad program in your radiology department where you can actually support a new grad nurse? Usually you come to radiology as your second, third, fourth unit and you come with these well-established assessment skills. And so I think it can be done. We have done it as long as you have the right infrastructure set up. I hope that people aren't nervous coming to radiology. I hope that they feel welcomed and supported. But it really has been in the past a place where maybe you are looking to get off of night shift. Maybe you're looking for a little bit more normal schedule. And that's not to say that we don't have people on night shift, because we do. But we also have a lot of people working during the day.
Got it. Got it. So, Wendy, what about your thoughts there? Because I know this, I say that because I remember at my last organization, the nurses in the interventional radiology suites, I'm thinking of on the inpatient campus specifically. Yeah, they were all over they would walk through to help with, an MRI and CT, but primarily we had IR nurses that were there. And it was very important. They reported up to, I think, the leader who oversaw the cath labs, because she was a nurse, right? And then matrixed into radiology. And then it changed. But when we created the manager or supervisor of IR, we actually went and hired a nurse, right? Because it was a whole thing. But I'm just curious your guys' thoughts more about, are there pros and cons to that, or what model have you seen, Wendy? I'm just curious.
I think that what I'm experienced at both of my recent organizations is very similar to each other. That there's the IR core IR nurses, and there's been a nurse manager over the radiology nurses as a whole. Same thing here at Seattle Children's. Although here at Seattle Children's, we have IR nurse manager as well as a radiology recovery nurse manager, and they're both newly onboarding new IR and recovery room nurse managers for radiology. So they're currently drinking from that fire hose of learning that Whitney was referencing. But yes, so there's a reporting structure within radiology to a nurse manager, and then that nurse manager though reports to the radiology director. And I think that, again, circling back to what Whitney said and what you said actually as well, Jason, that nurses reporting to nurses makes the most sense. And then administratively, for the business practice side and everything, reporting up to the radiology director also makes sense. I can say that our core leadership team across all of radiology here, respecting, again, scope, knowledge base, core practices and things like that. But then you have that feather up into the team leader of the director.
Yeah, and I ask those questions too. For me, reporting structures always are a funny thing, right? You hear me say, Wendy, you know me all the time, like, you need to earn the right to lead. The title doesn't give you the right ever, right? So reporting structures to me are more in the sense of, are you there to support your team? Do you understand what they do? Can you give them the education and the knowledge? Or I think Whitney said, just making sure they're tied into their scope of practice and understand what they're doing and advocate for their needs, right? So, theoretically, it should be anybody's a really good leader could do those things. But I do hear what you guys are saying about the importance of having someone that really understands it a little more cleanly. And that might be a nurse over a nurse, and or the fact that and at the end of the day, they got to be aligned anyway, right? So whoever's standing up top one day might be standing next to him the next day, right? And that's where the best relationships work, right?
Right. And that earn the right to lead piece, you can have a leader in any scope of practice, but we also know that people like that trust and that respect relationship. Your nursing leader or your tech leader may not be on site that day, and having those teams that are so symbiotic that they recognize, this is a person I'm going to grab in this moment. This person has this expertise and I'm going to grab them in that moment. And having the trust to know that you can do that without a leader present, and the leader supports those people in developing those skills, is also an incredibly, important part of a high functioning department that has that collaboration.
Yeah, exactly. All right, let me ask another one. Whitney, I'm curious from your side. Do you have any good stories or examples of where just the relationship really, really worked well and you're like, oh, I'm so glad I'm in this field, or you've heard something from one of your members or anything like that? I'm looking for a success story versus a challenge. If you have a challenge, you can share that too, but I'm most excited for the positive ones.
Yeah, I think that my best stories come from our safety events. I think that where the technologist and nurse relationship can help each other with MRI safety, with contrast safety, with specimen management safety, those are probably my most favorite stories, because that highlights what we're talking about here, the relationship between the tech and the nurse, and it reflects back on our most important piece of why we're all here.
Love that.
I'll admit, Jason, that when you asked that question, I don't know about you, Whitney, but the Rolodex or the cut film of images of really critical moments started rolling through my head. And it is the critical moments that I thought of first when you asked that question. I think the first two, honestly, it was like roll tape. The first two that came into mind was actually a complex medical situation that happened with a team member, with a staff member who sort of crumped on shift, and everybody swept in to help. Like, we were doing a really quick assessments. We were, putting in IVs. We were trying to figure out what happened. We were calling the code team over. Everything happened so seamlessly because we already had that relationship of collaboration and trust in our department to take care of this team member. And because of that, that person who became patient at that time was just impeccably cared for. And it was because of that trust and relationship that we had with our nursing team that it happened so seamlessly. And then the other side of that, when not necessarily the other side, but just another example, critical moments with patients where patients roll into your imaging suite. Particularly, I'm thinking about a CT suite event one day when transport brings in a patient. They were fine in the elevator. They crossed the threshold into the room and they're agonal breathing. And having a tech look at me one day, deer in the headlight, eyeballs, what do? I'm like, that's agonal breathing. Call our nurses, call the code team, call everybody. And again, it's those critical moments where trust and relationship come together with your knowledge and you meet the needs. And it's almost, when you have a team that has that relationship, saying it's seamless when it needs to be spot on, you move like a dance together.
Yeah.
And it's because of the work that you've done together that it happens so well. And the call outs, the echo backs, everything that happens to meet what we need to do in a moment is because of that team relationship. And
Well, the examples you're sharing, I mean, just takes one moment like that to say everything you invested, all the dollars, all the time, everything they've done, right?
Yeah.
Like that, the outcome that came there.
Yeah.
So I'll flip it real quick and then we'll dive into more about our new relationship here. But just to close in the loop on sort of our discussion about the nursing side and imaging, anything like any challenges you guys see with people or organizations maybe not fully appreciating the value of adding those nurses, and maybe what you might say to some of the listeners or folks out there that maybe don't have this set up in their organization or are trying to make the case for it? I mean, there's a lot we can infer from all the things you guys said today, but have you guys come across anything you might want to share, just kind of summing up this little part of our discussion in terms of maybe challenges you hear about or things people might be facing, to say, hey, we hear you. Here's how you might want to work through that.
Yeah, I think what I would say about that is, as we see the advancement of technology, just think about the expansion of access that's happening across all of our areas, across all of our hospitals, and think about how nurses can increase that access and partner with you to make sure that you're able to see the patients that you need to see when you need to see them.
Love it.
I agree. I also think that everything that is based in safety resonates.
I was going to say from your story. Right.
Yep. And when you bring it down to patient care, safety of both our employees and the patients within every aspect of a patient care continuum, again, like scope, nurses have a scope that techs don't have, and techs have a scope that nurses don't have. And advocating for having a full breadth of coverage that supports each other. Radiology procedurally gets more complicated the more we learn what we can do less invasively in radiology that doesn't have to require an open incision in the OR. Means the complexity of the cases, the monitoring of the patients, the collaboration of care within an imaging or a procedural suite is everything's, ante up. It's a little bit more, there's more gravity to it. So bringing the skilled and educated nurses into a radiology environment that can support those cases with their excellence and knowledge and skill set and work alongside us. Again, it's just it's like when techs have questions about things, I'm like, and they had an experience that was less than wonderful, I'm like, relate it based on patient care. We have a system called e-feedbacks here. So to report safety events. And I'm like, everything, if you articulate yourself based on safety and proper patient care and outcome, it's going to resonate and it's going to hit.
Yeah.
And so I think that's what we do together, is we protect the safety and the well-being of everybody we serve.
Yeah, I think that's great. And I'm hoping too, we'll get at the end. Actually, you know what? I'll do an outro there, is that if anybody's out there listening and wants to talk to either one of you and learn more about ARIN, about nursing, about your experiences, or ask questions on this, I think we'll put all of your contact info in our summary that's out there. Other than that, just wanted to say it so we have it, collected. So Whitney, the best way to get a hold of you would be?
Oh, email, LinkedIn, cell phone, all the things.
Okay. And then Wendy, same for you. And we'll make sure we put the email and the LinkedIn contacts into the the summary and something that goes with the podcast.
Absolutely. LinkedIn, super responsive. Or if you're an AHRA member, to be AHRA as well. Definitely open to anything.
All right. So then as we're getting towards the end here, let's talk about this. So we have the new relationship between AHRA and ARIN, which is so cool. I'm so excited. Whitney, you want to talk a little bit about your perspective on that, about sort of why you guys said yes when we kind of asked, and sort of your thoughts of this? And also, obviously, we're leading up to we're going to shamelessly promo for our annual meeting coming up in a few months. But yeah, I just want to share some thoughts from your perspective.
Yeah, I mean, I think that the partnership is a wonderful, wonderful development. We're so happy that you guys thought of us and asked us to partner. I think that because the advancement and growing need for radiology nurses within imaging, it makes sense for administrators and nursing to partner. And, we're stabilizing after not having conference for a few years. So the fact that you guys are willing to pull us in close and partner with us for conference is amazing.
Love that. And Wendy, as a board member, obviously you guys had to approve all of this and get behind it, and you guys kind of pushed for this concept. So
I think honestly, the first time that Jason, that you brought this up with me, I was like, it didn't even take a breath to be able to say absolutely in support. As somebody who, for a decent chunk of my career, I was an interventional radiology technologist, where that relationship between our techs and our nurses is part and parcel of every day in every case. And I have learned so much from our nurses and the collaboration, utmost respect. And so the idea of partnering with ARN and linking arms in our annual meeting was incredibly exciting. Whitney, I remember our first conversation where you and I met alone, and we instantly started like bouncing ideas off of each other about all kinds of things. Like, it was just very symbiotic from the start. And I am just super eager to be in Florida and to see what we do together and to see what we do moving forward. I think it's just only the beginning. And, this is one of those stronger together moments that I think that we're going to walk our talk together, and we're going to prove that we can, what we can do and what we can give our members on both sides, ARN and AHRA. And it's going to be a beautiful thing.
yeah, I love it. And I'm hoping that it's going, well, not hoping, I know it's going to be, year long and even past that, right? So it's not doing the podcast today is because I think it's really interesting to have people hear and understand the relationship between the administrative side and the nursing side, and just the different perspectives that you guys all shared. I think we're talking about articles, and we're looking at other ways that come with some best practices and some guidelines. And I know, Whitney, you mentioned a new core curriculum textbook that will be coming out that's going to be not only for the nurses, but also for administrators who may oversee nurses, to have that going forward. And I know that's coming out in a few months. We're excited for that. And then, specifically the annual meeting, right? So listeners that are out there, you can go to www.ahra.org and you can get all sorts of information there. Probably can go to the ARIN website or the ARIN website as well. Whitney, what is that again? Just so I don't say it wrong.
It's arinursing.org.
Perfect. So either one of those, and you can find information about the meeting. But I think that's July 12th through the 15th in Orlando, Florida. I'll also mention July 11th, which is Saturday, the day before. We're doing a bunch of workshops. So ARN has 2 different workshops that will run basically 4-hour workshops. So the idea is a smaller cohort of people. You get to really network and get to know folks and dive a little bit deeper into a topic. But I saw they're both going to be like around the world and trivia style, really interesting stuff on that side. And, AHRA has 2 going on as well. One's for executive leadership, and one's all about connecting patient experience and engagement with another one of our presenters, which is great. But I think Monday night, we're going to celebrate everyone who has a certification. So AHRA has the Certified Radiology Administrator certificate. And Whitney, you guys have the Certified Radiology Nurse.
Yes, the CRN. And so if I can talk about the workshops a little bit.
Oh, yeah, back it up. Sure.
We'll sign up for both workshops, because one is going to be focused on imaging and one is going to be focused on interventional procedures. And the certification exam is 35% interventional. And so if you're only doing one or the other in your daily practice, you probably want to study for both. And so we're hoping that, and we've done this recently, is pull your teams together, your interventional teams and your diagnostic teams, because they can help each other study to get certified.
I love that. That's great. I'm glad you added that little piece of the puzzle. And I know there's a lot more details if people go to the website and see all the different sessions, but there's just so many ways for us to interact there and network. And I think it's just going to be fantastic. And obviously being in person is something special. I mean, the virtual is great, but there's nothing like being able to be together in person and to celebrate those pieces. All right. So any other thoughts either of you have just in terms of our relationship, things that we'll be looking out for? Any other stuff you want to toss out to listeners?
I just want to mention how wonderful I thought conference was last year, coming to Vegas and meeting all of you. I'm really big on together time, and the warmth and support that I felt instantly with AHRA was something that it really set the tone for how I knew this was going to be a wonderful relationship going forward.
Thank you, Whitney. I think that's something I speak for. I'll speak only for myself, but I think that's exactly the experience that we want people to have when they come to a meeting like that. Meetings like annual meeting are large, and what feedback I hear from people, I brought 2 other leaders with me last year from Seattle Children's, and the feedback about they're in crowds, but they don't feel alone. They feel welcomed. It takes being introduced to one person who introduces you to 4 more people. And before the end of your first day, you've already got a network of support at the meeting and people who then see you in the hallway or in different breakout sessions, and they're introducing you. And so your network, your professional network, grows by leaps and bounds every day, and you learn things from each other. The informal mentorship that happens, the think tank that happens, even like you said, the together time outside of breakout sessions, at lunches, the community events that we have, everything is an opportunity to learn from each other and to grow those relationships. And then the connections that stay in place after annual are amazing as well. People who still lean into each other as resources. And now that we're linking arms with ARN, having people have nursing resources and radiology resources, new professional networks, that way they're going to blossom from this collaboration, like secret sauce. Super excited.
Mm-hmm.
Yep.
Well done. Very well said. Well, if you guys, we could go on, I'm sure, and I can't believe how much time we've had just now, right? So easy just to chat. So I look forward to more conversations like this and then to sharing more examples of what we're doing together. And obviously, Whitney, can't wait to see you in a few weeks. And obviously, Wendy, you too. See you in a few weeks in Orlando. So yeah, any other last comments or thoughts or?
No, just thank you. Thank you for giving us this opportunity to talk together. And like I said, I'm very excited about what we do this summer and moving forward. So, and thank you, Whitney, for being such an open and willing person to share your thoughts and to collaborate. It's all part of, making this an extraordinary experience for everybody that attends annual meeting this year and beyond. Thank you.
Thank you. You guys are awesome. And ARIN is super excited for all the things coming up bright and sunny.
Thanks for listening to Medical Imaging Matters, a podcast from AHRA, the Association for Medical Imaging Management. If you have enjoyed today's episode, please be sure to subscribe, rate, and review. AHRA is proud to be the trusted association for medical imaging management professionals, offering career development programs, a comprehensive selection of educational conferences and seminars, networking opportunities, award-winning publications, the certified radiology CRA credential, and so much more. To discover all AHRA has to offer, visit our website at ahra.org. Until next time.